When a pap smear indicates an abnormality of the cervix other than infection, the next step is usually a test called colposcopy. This involves direct examination of the cervix using a magnifying telescope and a bright light. Colposcopy is done right in the office, in the same position as a regular pelvic examination, although it may take a little longer. A vinegar-like liquid is often painted over the surface of the cervix during colposcopy. This turns potentially abnormal areas white, so they can be identified more easily. If suspicious areas are identified, a biopsy or small piece of cervical tissue may be removed with a special instrument like this one. This procedure is usually painless, although it can trigger mild cramping. A small scraping also is taken from inside the cervical opening with other special instruments. This is called endocervical curettage. A tarry black discharge and light vaginal spotting may be noticed for a few days after the biopsies due to a chemical put on the area to stop bleeding. It may be recommended that intercourse be avoided for a period of time. After the biopsy results are back, any further treatment that is necessary can be planned. Mildly abnormal changes are usually treated with cryosurgery, which is freezing of the cervix, or with laser surgery. Both methods destroy the abnormal cells. After several weeks of heavy discharge, the cells which grow back are usually normal. Return visits for repeat examination are very important after these procedures to be sure the problem is completely resolved. Sometimes surgical removal of a larger portion of the cervix, known as a cone biopsy, or more extensive surgery such as removal of the uterus or hysterectomy may be recommended. This is done in the hospital. Colposcopy also helps to identify other cervical disease, including condyloma, or warts, which are sexually transmitted and which may increase one's risk of developing cervical cancer. Colposcopy generally causes little discomfort and takes only a short time. It should be reassuring to know that this important test can help provide information about your health that is not easily obtained during a routine examination. And almost immediately after colposcopy, you should be able to resume all of your normal activities.